Okay, so good morning, everyone. Today we're going to speak more in regards to something that it continues to plague the news every day, right? I don't know if you saw the statistic released this past week, in which definitely now we have the stats from 2020, 93,000 overdoses actually led to fatality last year, right? Out of those, 76,000 actually were opioids involved. So quite a big chunk, definitely, but at least we have another 20,000 deaths that more likely were due to stimulants as well. So opioids continue to be, hands down, one of the things that afflicts us the most. So I think having methods to help someone who has gone through an overdose is key, and that's why we're going to speak today about how to utilize NARCAN, okay? As we can see here, some stats, right? We can see that this is important to know. Drug overdoses are leading cause of death in Americans under 50 as of the past 2 years, okay? Before that, does anyone know what used to be the leading cause of death in people under 50 years of age? Close.
Heart disease?
Heart disease will be above 50. High blood pressure, not yet. We tend to see those accidents, exactly. So pretty much opioid-related overdoses have taken over all what accidents used to do, being the first cause of death. So it's something that definitely has marked the lives of a lot of people, including family members as well. Okay, and what we see here is how the whole opioid epidemic has behaved for the most part all the way until 2018. Okay, we can see that things kind of started to be tracked around the end of the 1990s, and we see clearly how initially we have that heroin, commonly prescribed opioids were for the most part the most common thing, especially commonly prescribed opioids. We can see the purple line right there. As time has gone on and prescription mechanisms have also been changed, we see how the commonly prescribed opioids, oxycodone, OxyContin, Dilaudid, Norco, the deaths due to those have decreased. Heroin has had a little bit of an uptake, especially in the 2010, but more than anything, synthetic opioids just peaked around 2013 all the way to 2018, and now we have that most of the common cause of death is actually fentanyl, right? Why? It's cheap, easy to produce, okay? And from the standpoint of whoever sells it, right, definitely is highly profitable, okay? The problem for us as providers is that highly toxic and definitely is really difficult to treat. Now, we do have tools at least to help people who potentially have an overdose, and the biggest tool that we have is called naloxone, which it comes in different presentations, okay? Definitely there is an IV form, there is an injectable form that goes on the thigh, but the most commonly known is this little spray that we have here, okay? Reason being different. One is how easy it is to use, and two, price, okay? Definitely IV formulations, we reserve those to hospitals. It's easier to draw everything on needles there when we have lines open. The injectable form on the thigh is still quite expensive. Each cartridge is about anything from $750 to $1,000 per cartridge, so it's still really expensive. In the meantime, the nasal spray is more widely used, simple to utilize, covered by insurance as well. So those are the advantages. Now, how does NARCAN reverse an overdose? Pretty much this is what's going to do. When someone witnesses an overdose, right, it's because that opioid receptor is stimulated in fully, okay? That causes, at the end point, respiratory depression. We see the NARCAN molecule right here in green. So what is naloxone, brand name NARCAN, going to do? It's going to come and displace, it's going to push away the opioid, okay? By doing so, the opioid will be released to the bloodstream circulation and eventually destroyed, okay? So that's the way in which it's going to do. Pretty much we're playing musical chairs with someone who doesn't know how to play it, okay? Sees the guy sitting there and it's like, move, okay? Pushes it away, and then in the meantime, we see the opioid reversal. Now, that doesn't imply that NARCAN is the only and only solution at that specific point in time, because these two are going to fight for that seat, okay? What is going to determine who wins or who loses the battle? One, the potency of the opioid we're facing, and two, how long is that opioid being able to stay within the body? NARCAN or naloxone has a half-life of about half an hour, okay? So if you have something that lasts longer than that, the possibility that Narcan is going to displace itself from the seat is going to happen, and the opioid is just waiting to sit back on it. That's why we always need to call 911 to make sure that the secondary treatment is provided. This is just immediate. Does that make sense?
Yep.
Okay. So, what do we do to recognize an overdose, okay? So right here we have some of the signs to look for, okay? Some of the things, patients may not be able to be waking up, and you have these ones in the second page of the papers I gave you, okay? You might see the discoloration of lips and also nails, okay? They may look bluish, okay? We're going to have slow breathing. It's going to sound like they're choking. Definitely they're going to have a cold and clammy skin. They might feel dizzy, still not yet, syncopized or fainted. And the pupils there will be really, really small. Okay, if you see big pupils, the likelihood that an overdose is due to an opioid is highly unlikely. Okay, something else might be interfering with that specific picture. Okay, so what do we do? The first thing, we need to know the symptoms and recognize that pattern. Okay, second, we're going to need to call 911. Okay, third, we're going to see where we have strategically placed our naloxone containers, specifically here in our facility, okay, which we have some specific places where we have it. Ideally, put gloves on, okay? Remember, some occasions when people overdose, they may have fluids like vomit especially, okay? Or maybe they have some mucus, so you want to protect yourself as well, okay? And then you're going to want to wait with that person until the emergency medical services arrive. Okay, so those are the steps that we are to follow. Ideally, if we can, provide basic life support, whether it's in the form of CPR, if we see that we don't have appropriate responsiveness from the patient. Now, how to use naloxone. Here we have the steps. The good thing, if you don't remember these steps, do not worry. They're on the box as well. Okay, so once you open the box, this little flap is going to have exactly the same thing. You didn't pay attention, you threw away the box. Don't worry. When you open the little box and then you actually get the spray from the package has another little flyer that tells you one by one of the steps, okay? If you don't remember, that's okay. There is an app, okay? Literally it's called the NARCAN app. So you download it on your phone. So there is a way, okay, definitely to find how to utilize the naloxone spray on our patients in multiple ways, okay? And that's why the most important thing is to remain calm, right? Because at the end of the day, the only way in which we're going to bypass all these safeguards that we have to be able to utilize the spray is only and only if we're in too much stress, anxious, and we're not paying attention exactly to where we can find these answers. Does that make sense?
Yes.
Perfect. So let's do a little demonstration with these two guys right here, okay? So you said that you wanted to baptize them. So what do we want to call this one?
I'll call him Tom.
Tom, okay. So we have Tom, right? And maybe Tom in this case, right? He seems to be quite drowsy, not breathing well, right? So what are we going to do? We're going to try to wake up Tom, right? Like, hey, Tom. Nothing. You can rub on his chest. Tom, wake up. No response, right? Then we adduce or suspect that definitely we're facing an opioid overdose. Now, let's not forget, naloxone will not revert anything else but opioids, okay? So if it's benzos, alcohol, the cause for which we have loss of consciousness, this will do nothing, okay? And that's why we need to always call 911, okay? So Tom cannot be waking up, right? First thing I'm going to do, I'm going to go to my kit, get my Narcan, get my gloves, ideally shout out to someone, I need help, okay? And call 911, okay? That should be called like something bad is going on, and the other person should not go like, why, okay? You just call 911, grab a cell phone or a wireless phone, okay? And go upstairs while calling 911. Tom being unable to be waking up. So what are we going to do? We're going to tilt the chin up, okay? Then we're going to introduce the tip of the spray all the way up. My apologies because this thing doesn't fit on the little mannequin. All the way until your fingers actually touch the tip of the nose. And from there, you just deploy it, okay? How long to wait for a response? No more than 2 minutes. Okay, if you don't see response on Tom for more than 2 minutes, okay, possibly we're facing fentanyl. Okay, you might need more than one of these ones. Okay, with fentanyl you might need 2 or even 3 occasionally on those overdoses. Okay, now definitely it's not a good idea just to be like, okay, I'll wait for 2 minutes and I'll chill right here, right, to see if he wakes up or not. Okay, ideally we should start CPR on those cases as well. Okay. 191, the emergency medical services arrive, we allow them to take over, we tell them how many of these ones we deployed, okay? And then they're going to do the respective measures after that. Does that make sense? Okay, so this is how the bottle looks. All of you saw it. And just a video just to see again how to utilize it, okay?
If you suspect someone has overdosed, try to get their attention by firmly rubbing your knuckles up and down the center of their chest. Next, call 911 with your location and the person's symptoms. Now it's time to administer naloxone. Peel back the package to remove the device. Place the nozzle tip in their nostril until your fingers touch the bottom of the nose. Press the plunger firmly to release the dose. Place the person on their back and tilt up the chin to clear the airway and support breathing. Give a second dose if the first one does not work within 1 to 3 minutes. Care for the person by rolling them on their side. Stay until medical help arrives.
Okay, so things not to do, definitely. Oh, sorry about that. Things not to do, okay, when you suspect an overdose, right? Definitely don't try to drown them in water, right? So don't try to splash water on them, okay? That will not wake them up, okay? Plus, outside of that, right, some of these fluid may enter their airway. That's one of the things. Let's not try to induce vomiting on anyone, okay? As I mentioned before, right? Opioids can cause an overdose, but there are so many things that can do it, and occasionally they can be caustic, right? And actually, if we make someone throw up, they might cause burns on their esophagus, right, and cause strictures in the future. So definitely we need to avoid those things as possible, okay? As it mentioned really well in the video, the ideal is to keep the airway open. So that's why we tilt up the chin. This is called the sniffing position, okay? This is the way in which our airway is fully open. Because when we have our neck bent, for the most part, the trachea can occasionally close and not allow for proper flow of air, okay? Especially depending on the size of our neck, thickness, and all that, okay? Any questions? Yes?
Why do you rub the knuckles on?
It hurts.
Does it hurt?
Oh, yeah. So remember, if someone is unresponsive, right, definitely, I'm not going to suspect an overdose if I go like, hey, Tom, okay, that's, yeah, highly unlikely they have overdose, right? This is a person who's not responding well. I go initially, hey, Tom, nothing. Hey, Tom, nothing. So now we need to do something that hurts, right? Definitely we won't do anything that is abusive. So therefore, what we're going to do, we're going to rub with our knuckles. Try it yourself. Try to rub your knuckles on your sternum. Kind of hard. It hurts. Yeah, it hurts, right? So anyone will at least move, right? Be like, shoot, that hurts, okay? So yeah, definitely, that's why we rub on their chest, okay? It's the easiest way to get a response from a patient. Okay. Does that make sense? Yeah.
What is the dangers of giving someone too much NARCAN?
Really good question. So NARCAN does have some side effects, okay? The initial things that you will notice, okay, is going to be that if definitely the overdose is due to opioids, a lot of symptoms from withdrawal will come. Muscle pains, they're going to start with the teary eyes, runny nose, potentially diarrhea may happen on the spot, okay? Worst case scenario, and it's rare to see, they can actually have water leaking into their lungs. It's rare. I've seen it just once, honestly, and this is a person who actually we had in a NARCAN drip. I haven't seen it when it's deployed with the spray. But at the end of the day, right, that's why you call 911 to come and take care of the rest, take him to the hospital, be evaluated, because we have a person who was literally dead, right? If someone has overdosed, their heart and respiratory system has completely stopped, right? So they're dead. We brought him back. Now we just need to take care of, in this case, what is called pulmonary edema, which is rare to happen. I've seen it only once, yeah. Any other question? Nope.
That's it.
Okay, awesome. Who wants to play with Tom and Thomas? Let's see.
So what are we doing? We just
Yeah, so you find definitely Tom right there, non-responsive. It's the morning. He just went to the bathroom, came to bed, and you're trying to wake him up at 7 a.m.
okay. Hey Tom. Hey.
A really nice rub, just with your, either with this part of your hand or with your knuckles, but just not the whole fist, okay? So something that hurts. There you go, nice.
Okay.
A nice rub. So Tom is not responding. What do we do now?
Okay, so we're gonna lift his head, and then
So you go, but do you have the Narcan on you right now?
right here.
Well, but in a scenario like,
obviously you go get the Narcan.
okay, well, you go get the Narcan running, what else do you do?
You have to scream to have somebody call.
Go for it.
Hey, somebody call 911.
There you go. Nice. He's a good actor.
And then I would go get the Narcan.
Who's calling 911 right now? Okay. Okay, come with your phone, because you need to know what's going on.
And then what I would do is
911 was your emergency.
Hit the emergency button. Right?
Yeah. 911 was your emergency.
push the
Leave
Narcan
the guy unconscious.
all the
here.
way up.
Yep.
To
Let's not
my-
forget to build the chin up. Good.
Chin up and all the way up to the
Mhm.
knuckle, right to the tip of the nose, and then press it. And then, wait 2 minutes
Mm-hmm.
and do CPR in the meantime.
You can do CPR in the meantime, right? While he's calling 911, he might have a response that they're sending someone, right? And he can come and help you with CPR. And then if we have another staff member here, right, ideally he should tell that person, hey, I just called 911, go and wait outside until they come. If not, he has to be paying attention that they may come anytime soon, okay? So that's why it's important to know and strategize how these emergencies may happen, right? Because if it's just two of you, right, you know what your diligences are, okay? If you have somebody else, don't be like, okay, I'll wait and I'm going to go downstairs. No, you stay with him, with Nick, okay, and you tell somebody else to go and wait for EMS to arrive. Does that make sense?
Mm-hmm.
Yep.
Perfect.
Great.
Any questions? Excellent. Okay, thank you for your time. Thank you. Okay. Oh,
I do have one question.
yes, go for it.
Why were the usage of opioids dramatically increased starting between 2012 and 2013? I saw on
Oh, okay, really good point. So,
the chart.
yeah. So pretty much, the increase of non-prescribed opioids started in that fashion because at least at that moment, 70% of people who were using, whether it was heroin or fentanyl, they said with prescription opioids. The clamping down on the prescribing of opioids at clinics and such pretty much started around 2013. The proper guidelines didn't come back until 2016, but definitely you started to see the reduction on how many pills prescribers will give. So what happened, right? A lot of people who were under distress and withdrawing, kicking, right? You're going to try to resort to solve that problem. And what do? You go to the streets to find something that can take care of that, right? So if your doctor is not giving it to you, then you're going to resort to purchase on the streets. And that's why you see an uptake at that moment in time, pretty much just shifting of some of these individuals who were receiving pain medication somewhere, they just shifted to the street to receive whether it's heroin. At that moment, we didn't have that much fentanyl. Mm-hmm, yeah, and then after that, right, the clamping down continued. You see that the trend of less and less prescriptions. And what did you see? More fentanyl coming up, right? Why? Because kilo per kilo, fentanyl and heroin, the cost is exactly the same, but you can sell a lot more for 1 kilo of fentanyl compared with 1 kilo of heroin because you need less amount. Mm-hmm.
Just to add to that, there was a period of time where the doctors all received notifications from their governing bodies saying, you cannot continue your prescription of opiates. Like, for example, my mom has some issues and she'd been on Vicodin for years, and her doctor said, sorry, I'm not going to risk my license, I'm not going to prescribe this anymore, so you got to go to a pain clinic. So that was probably around the time that you suggested. And then as of late, more and more police are finding fentanyl in other drugs, marijuana. they're basically lacing everything with fentanyl to get people hooked on it.
Yeah.
They don't know that they're smoking it.
Yeah, it's a lot, definitely. Xanax is laced with fentanyl really often, so definitely that's why we see an uptake on all these things, right? That's why you find that some occasions some people may think, okay, I'm just using speed, for example, right? But when they present, they may have opioid withdrawal symptoms, right? You test them and definitely fentanyl is present, and it's because of that specific situation. Definitely more and more things are being laced with fentanyl, which is leading to more confusing problems and definitely more complex situations for everyone. Yeah.
You got a lot of patients coming into treatment and they get their drug test and they're like, we found fentanyl. I was like, I've never done fentanyl.
Yep.
So it's becoming like treatment centers around the world are reporting this massive increase.
Yep.
And it's scary for kids, right? Trying marijuana for the first time.
Yes, definitely.
It's a really unfortunate situation.
Yeah, it's a interesting thing. So definitely working towards trying to decrease those overdoses over time. Yeah. Okay. Excellent.
Thank you, Dr. Meza.
Thank you very much.
Thank you very much.